Hello everyone, hope you are doing well. My name is Hamideh Hosseini. I'm PhD student in computer science at Concordia University. Our research subject is integrating real-time health status into everyday objects, a design case study on enhancing diabetic health monitoring with artistic creations. Imagine a world where objects seamlessly interact in response to real-time health change. In this research, we combine health, technology, and art to explore seamless diabetic health monitoring. Diabetes is a metabolic disease that can cause serious damage to the heart, blood vessels, eyes, and kidneys, and can lead to limb amputation if not managed correctly. The motivation of this research is influenced by my experience living with the diabetic individuals and the discomfort in the home environment because of repeatedly asking about health status. Here, you can see the steps of using glucometers, which is a self-test for monitoring blood glucose levels, and caregivers or patients should use it based on symptoms such as dry mouth they observe in the health state of the diabetic patients. We aim to facilitate monitoring diabetes by using unobtrusive technology and improve communication between diabetics and their relatives or caregivers in a home environment. Our solution takes inspiration from the field of human-building interaction, ambient-assisted living, wearable technology, and health monitoring. In this slide, we mention some of our important references. In HBI, one of the references works on interactive appearance changing of work using thermochromic paint to explore people's living practice around everyday objects. In AAL, one of the researchers constantly monitors and controls patients' disease utilizing mobile and biometric devices through the use of technology including sensors and embedded systems. The wearable technology that we consider in this work is smart diabetic socks like Siren with 6 temperature sensors on each sock. So, by creating subtly changing artworks in an ambient living context as well as changing smart watch faces that are based on health status, we can allow for gentle non-emergent notification to the diabetic and their caregivers or relatives to create health status awareness. In order to gather user perceptions, we organize a series of interviews. Interviewees mentioned that sufferers of chronic disease feel hesitant to speak about their health condition and subtle change that may lead to more adverse effects. Part of our design concept was to create a dynamic wall painting with a thermochromic fabric that responds by changing color slowly to reveal patient's status. The default color for the mountain in the artwork is yellow, and when this color starts to change into red, it is a sign of health-changing status. We also provide a matching watch face that updates the background color of each user interface with diabetic health status. The hub receives information from the sensors in the smart socks, the microcontroller which is in the back layer of the painting, and the smartwatch of patients or their caregivers receive data from the hub. For the smartwatch faces, we consider 2 distinct backgrounds. As a conclusion, we can say by remote monitoring and early diagnosis, the cost of diabetes care can be decreased and the health of patients will be guaranteed. Furthermore, by allowing for the ambient incorporation of health status, it may be possible to reduce the stress and improve the atmosphere around health conversation in a home environment. As our future plan, I can talk about presenting a full prototype, expanding the range of sensors like CGM sensors, considering another home objects to convey health status, and assessing the acceptance rate of end users utilizing this system. On this page, you can see some of our references. Thank you so much for your attention.